University of Michigan Health System began exploring lean thinking 5 or 6 years ago, significantly before I joined the organization. We started by engaging in specific learning projects that provided proof of concept, and we're now focused on broader efforts to embed lean thinking in everyone's daily work. With the Michigan Quality System, we have an infrastructure in place to develop lean thinkers throughout our entire organization. What strikes me about the approach is how well suited it is to an academic health system because of its fundamental use of scientific problem solving. Through the use of PDCA, plan, do, check, and adjust cycles, the approach emphasizes the importance of reflection and learning through experimentation, not just getting quick results from a project. We're building a learning community, and the curriculum is our work.
A lot of that work was done by taking a large institutional problem which crossed many different departments and bringing a cross-functional team together, where the team went through a process of understanding their current state, gathering some measurements around it, targeting waste, and really walking away with a future state that they wanted to put in place in order to eliminate that problem from happening within their departments.
Wonderful things have resulted from all the different work that has gone on throughout the health system, but we're looking to take that next leap in how do we build this just into everyday activities.
I'm proud that the University of Michigan Health System is an early adopter of lean thinking in healthcare, and I'm very excited about our lean in daily work model. This has been developed by our staff, and it's custom made for our environment and our needs. This model will fundamentally change the way cross-functional teams work together to solve complex problems.
We start by defining, measuring, and visually displaying our key operational metrics, which are directly linked to institutional strategic measures. In addition, the team ensures that the metrics are aligned with what our patients and internal customers tell us they value most about the services that we provide. The measures are updated visually in the area at a minimum on a daily basis so that we know exactly where we stand in relation to our goals. At the same time, we are keeping a real-time count of our more complex problems, which is visually displayed in the area on a Pareto chart, which is nothing more than a bar chart ordered from highest frequency of occurrence to lowest. We then rely on routine and standardized daily interactions to help identify specific problems that are getting in the way of delivering value to our patients and our internal customers.
A short daily team huddle takes place at our visual board in which we review our metrics, document the specific issues or problems we are facing that day, and brainstorm ideas for process changes that may have a positive impact on them. A leadership Gemba walk, Gemba meaning where the work actually takes place, occurs daily, not for the leader to micromanage, but to become more deeply connected to the problems faced by the team. During the walk, the leader dialogues with patients and families in an effort to better understand their experience, carrying forward any opportunities for improvement, as well as providing positive recognition to deserving faculty and staff. In addition, the leaders dialogue with team members around their specific ideas to address surfaced problems. They ask thought-provoking questions to mentor their team in the scientific method of problem solving, and ultimately the leader walks away with specific actions that they can follow up on to break down barriers and challenges faced by the team. This standard process is repeated on a daily, weekly, and monthly basis based on how close the leader is to day-to-day operations of the area. The team leads will then review the Pareto chart, typically on a monthly basis, to prioritize the more complex problems faced by the team. Typically, the problems with the higher frequency counts become prime candidates for deeper reflection and attention.
As you can see, problems are surfaced during the daily team huddle and discussed with leaders during the Gemba walk. Additional new problems may also be surfaced and documented during these conversations. The team will then, in the Gemba, perform a quick triage based on the complexity of the problem. Based on this quick triage, one of 3 problem-solving approaches is used. Problems with low complexity often become just-do-its and rarely need a written plan other than to communicate across the team. Problems deemed to have a medium level of complexity are addressed using the Everyday Lean Idea form, which is a standardized process that allows the team member to document their idea and plan for running an experiment to test the change. Problems with a high level of complexity are addressed using structured A3 problem solving, which follows the scientific method for identifying and addressing the root causes of our more complex issues. In this approach, different teams from across the value stream are invited to participate in the problem-solving process.
Problem solving is built into already established team meetings to continue to develop our problem-solving skills, and of course to continuously solve problems. The results and learning from our experiments, whether successful or not, are then documented in a knowledge transfer repository, which is accessible by anyone in the health system. This allows us to more easily collaborate and learn from each other, while at the same time strengthening our position as a true learning organization.
In the Department of Urology, we treat patients for urologic conditions, anything from a urinary tract infection all the way to urologic cancer. Michigan quality system for us is something that we actually sought out. Myself and two physicians in our department went to lean training, and we came back and we were very excited about lean and really tried to teach lean concepts and tools to folks in our area, but without sending them for 4-day training, it was really actually a struggle for us.
So what you see here on the screen is really what makes up what we call the level 1 implementation of the lean and daily work model.
When we first started working with urology, it was really about working with the leadership team and how we were going to design the rollout of this model, and really thinking through creatively how we were going to approach the workshops themselves in order to have everyone be able to take part in them. We had actually 3 identical sessions in order for folks to get through all of those different activities and to be a part of building that infrastructure.
So we said, who are our customers? Our customers are our patients, of course, number one, our providers and staff. And we said, what was important to our customers? And time was the thing that just kept coming over and over again. Patients, providers, and staff all value their time. Patients want quality care, but they don't want to be here all day to get it. And so we said, how long should a patient really be here? And 60 minutes was where we agreed upon that the bulk of the patients, 80% to be exact, 80% of our patients should be here within 60 minutes or less. We really felt that that would give the physician time to provide quality care to the patient, but not have the patient be with us for a long-term visit.
So our board looks at phone calls that are completed within 72 hours.
Melissa Eversole and the urology leadership team wanted each of the different groups that made up their department to have their own value metric board. The front desk has a value metric board. The main clinic team has a value metric board. The nursing team has a value metric board. The call center has a value metric board. The surgery schedulers. They all were able to then be engaged.
So we're going to actually start tracking the KUB portion now to see when patients are late.
It certainly made me much more aware of the day-to-day problems that are taking place everywhere. It's a bit more of a time commitment, but I get to interact with the employees on a level that I haven't been able to interact with them in the past, so it's fun. When we first put up the boards, everybody was concerned that they weren't meeting their value metric. And we kept telling them, listen, this is not a test to see if you can meet the value metric. The idea is to come up with problems that are preventing you from meeting the value metric. And if we can't come up with problems, that's a problem, because the whole point is to make them comfortable enough to approach us with things that are getting in the way.
The value in the Gemba Walk for us is the improvement in the relationship between leadership and staff. We have our finger on the pulse about where things are at in our area, what the needs of our people are, and what the needs of our patients are.
One thing that the model has really helped with is the ability to build physician engagement right into the model. What this model has allowed the physicians to do is to really see how certain activities connect directly to operational metrics.
What it's done is change the dynamic between the employees and the managers. The employees are engaged, they see that we're engaged, and they're less timid about approaching us about things.
As part of our Everyday Lean Idea process, we implemented a patient comment card to ask patients what their thoughts are about the service that they received from us. And it's been pretty amazing because they're saying, what have you done differently? I was able to get back into a room much faster. My entire visit was a tremendous amount shorter than it has been in the past. And so patients are making comments about it. We've seen it right in writing, and so it's pretty exciting.
We couldn't be more proud of the Department of Urology. They've really owned the process. Each time they go on a leadership walk, everyday lean ideas continue to surface. They've really started to embrace the structured problem solving, so they're building that into their meeting structures, and I only see them making improvements to the model.
So whether you're just beginning your lean journey and you're putting the lean and daily work model into place, or you become a more mature lean department where you have the culture in place, we'll be better equipped to provide the services that we need to our customers, to our patients every single day.
We're so proud of this model. We learn so much from each group that we work with, and we're able to use that as making the model better each and every day. But we also recognize that the model is absolutely nothing without the passionate people that are working within it.
When you view the change that we've made within payment posting long term, it's brought us so much back that that initial investment of time, that's exactly what it is. It's an investment. It has changed the culture of our department for real, not just in theory or in words or something to put on a poster. It really has made a difference.
I cannot think of a single thing I don't like about it. I like everything about it. It's a pleasure to watch the employees take responsibility enthusiastically and have fun.
I'm so proud to be part of the University of Michigan Health System. As a community that's dedicated to creating the future of healthcare through discovery, the health system abounds with remarkable energy, commitment, and enthusiasm. Our Michigan quality system will allow us to achieve our goals.